I know a lot of conventionally trained doctors that when I speak to them about integrative medicine, biological medicine, they sort of roll their eyes. They respect what I do. They respect my father's been in this industry for a long time, but it's hard to make that shift. And I always like to hear how conventionally trained doctors like my father started to get into that process of breaking out of conventional medicine. So tell us your story of what really got you to start opening up outside the conventional paradigm and start to embrace some of these more alternative approaches.
Okay, good. So I started as a pediatrician. I did a residency in pediatrics and a subspecialty in infectious disease. I was co-director of a neonatal intensive care unit. So we had babies on ventilators, and I was also doing hospital infectious disease. It was the early 80s. It was the beginning of the AIDS epidemic. I was in San Diego. So there was a lot of strange, interesting infectious disease going on with these guys with AIDS. And then a whole population from the Southeast Asia were brought into San Diego County, Hmong people. They were helping the Marine Corps in Southeast Asia during the Vietnam War, and they brought a whole bunch of them over. And there was a huge amount of parasitic disease. So I was involved in this. It was very interesting. I was an adjunct professor at the university, so I was helping teaching residents infectious disease, attending on the wards. And then I got interested in emergency medicine, and I sort of shifted careers and started doing full-time emergency medicine. It was at the time where we moved to Florida in 1990. And I was happy. I liked ER medicine. I was at one of the top 100 chest pain centers in the country. And I liked the acuity of it. I liked action, and I was having a good time. My wife started to get interested in natural medicine. She's an RN, and she started going to Jeffrey Bland seminars. Jeffrey Bland is like the father of functional medicine. I think he's the guy who came up with even that name, functional medicine. And she said, "You got to hear this guy. He's the smartest guy I ever heard, and he makes a lot of sense." And I was like, "Nah, not interested." And so one day he was doing a 2-day seminar in Orlando, and she dragged me to the seminar. And he was one of the smartest guys I ever heard talk. He was just brilliant. He was a nutritional biochemist. He'd worked with Linus Pauling, and he got me interested in nutritional medicine and functional medicine. So I started to go to seminars with her, and we had some relatives that had sort of complex medical problems. And one of them had decided that they didn't like the mercury in their teeth, and they were going to get the mercury taken out of their teeth. And mercury's poisonous. You take a 500 milligram filling, which is about what a filling is. And if you ground it up real fine and put it in a 10-acre lake, and then you tested the fish that lived in that lake, the EPA would put a fish advisory on the lake that you can't eat the fish because one filling in 10 acres would poison the fish to the point where you couldn't eat it. Now, you have an average person who's got 6 or 8 or 10 or 12 of these fillings. Mercury boils at 110 degrees. It's liquid at room temperature. I like my hot tea at 160. You're going to boil the mercury out of your teeth. It's going to go into your brain. It's going to go into your throat. It's going to go into your GI tract. And it's bad stuff. And at the time, it was in contact lens solution. Ethyl mercury, thimerosal, was in contact lens solution. It was in vaccines. And so mercury was in people's teeth. And so this person went to a dentist who wasn't trained properly and got 12 fillings drilled out with no protection. And then 6 weeks later started complaining about thyroid swelling and went to the endocrinologist. And the endocrinologist said, "You have Hashimoto's disease." So they did some tests on the blood. They saw that there was an autoimmune, like the immune system was attacking the person's thyroid. And there's no treatment that we know of for it. Your thyroid hormone levels are okay, so you don't need medication for it. And what we just do is we watch this because there's nothing that we know of to do. Well, a few weeks after that, the person started complaining about pain in their right upper quadrant where the liver is. And some blood tests were done, and it showed that the liver had showed inflammation. And that person was sent to a liver specialist. And the liver specialist did some scans and some ultrasounds. You don't have a tumor. We don't see anything there. Probably this is an autoimmune reaction similar to the thyroid, but we don't know what causes this thing. They screened her for a bunch of different hepatitis viruses, and they couldn't find it. And then this person starts to have weakness of an arm and weakness of a glute. And this person is a triathlete and very good. And then the person got sent to a neurologist. Like, why can't I brush my teeth? Why can't I lift up my arm? Well, the neurologist did an MRI and said, probably you got MS, and that's also an autoimmune disease. So this fits. You know, you got a thyroid that's being hit, you got a liver that's being hit, you got a brain that's being hit, and now you need real medicine. You know, you need prednisone and interferon, and you need real drugs because we have to shut off your immune system because it's attacking you by mistake. And about this time, I was with this person, and next door to their office, a dentist had moved up from West Palm Beach. We're in Clearwater, Florida, and he had opened a dental practice. And on the marquee, it said natural dentistry. So I'm with this person, and I was dropping her off to her office, and I see the dentist walking out of his office toward his car, and I stopped him and I just introduced myself. Hi, I'm Dr. Minkoff. My practice is only a few blocks away. I mostly do emergency medicine. And what's natural dentistry? So he said, well, we're different than most dentists because we believe that the mouth is actually part of the body and that you wouldn't do anything in the mouth that you wouldn't do in the body. He said, for example, if you have gangrene in a toe, like an infected toe with dead tissue, you have to surgerize the toe. You have to get it out because it's dead. And the body, and it's infected, and the body has no blood vessel access to it, so the body can't defend it. You couldn't give this person antibiotics and cure that infection because they just won't reach. Likewise, if a surgeon, someone had a bad bellyache, and they went open to surgery, and they found that there was a portion of the bowel where the blood vessels had been cut off, and the bowel was now gangrenous, you have to cut that portion out because the person would die. The infection would spread all over. So he said, when a dentist does a root canal procedure on a person, what you have is gangrenous tooth that's dead and it's infected and it's poisoning the body. So he said, as natural dentists, if the teeth is in the, if the toe's on the body and it's got to cut out, and the bowel is in the body, it's got to cut out. Well, if the tooth is in the body, it's got to be cut out because you can't do that. And he said, now there's a whole problem with mercury because mercury's poisonous, blah, blah, blah. And so we don't do that. And if we take the mercury out, we have to do it very carefully because if you take a high-speed drill, you will cause these particles to aerosolize. They become, they vaporize basically. And if the person isn't protected, they will breathe this stuff and inhale it. And it gets in their palate, it gets in their nervous system. It can get in their liver and it can get in their thyroid. And I'm like, oh, this is what's wrong with this person. And so I said, well, here's the story of this person. And he says, they're mercury toxic. But there's no one in this town that's going to help you. Help her. You got to go to Seattle. And there's a smart doctor there. And he does courses for doctors on how to do this. And so I go to Seattle and I do this course. And my mind kind of gets blown because I'd got an introduction with Jeffrey Bland. And then I get a few intensives of training from Dietrich Klinghardt. And then another very famous Swiss doctor, Thomas Rau, comes over, and he's 2 years in a course, and I'm spending 2 years with him. And I'm learning from these, and Yoshiaki Omura is at Columbia, and I spent 180 hours with him, and I learned neural therapy and biological medicine. And I'm like, holy cow, there is an enormous world here of really good medicine.